There is no shortage of advice online about improving sexual performance without medication. Most of it is either supplement marketing or generic lifestyle guidance that doesn't actually help you decide what to do. Let me give you the cleaner version. 3 approaches have genuine clinical evidence behind them. The first is focused shockwave therapy for men where a vascular component is involved. It uses low-intensity acoustic waves to stimulate new blood vessel growth in the erectile tissue, improving blood flow at a structural level rather than on demand. Multiple systematic reviews support it as an effective option for vascular origin erectile dysfunction with minimal side effects. Around 50 to 70% of men with mild to moderate vascular ED see measurable improvement. It's not the right fit for every cause, which is why knowing whether your symptoms have a vascular component matters before choosing it. The second is pelvic floor rehabilitation, specifically for men where pelvic floor dysfunction is a contributor. The pelvic floor plays a direct role in erection through a vascular mechanism, and tight, overactive pelvic floor muscles, which are common in younger men with desk-based work and high stress, can significantly affect sexual performance. The clinical evidence for targeted pelvic floor therapy, improving both erectile function and ejaculatory control, is solid. The critical point: if the pelvic floor is overactive rather than weak, Kegel exercises are the wrong approach and can worsen symptoms. Assessment determines which direction treatment should go. The third is aerobic exercise, which has dose-dependent evidence. 3 to 4 sessions of moderate to vigorous aerobic exercise per week, sustained over at least 12 weeks, consistently shows improvement in erectile function across multiple studies. The mechanism is cardiovascular. Better fitness means better blood flow, including to where it needs to go. Supporting factors with real biological relevance include sleep quality, because most testosterone production happens during deep sleep, alcohol intake, which is vasodepressive and suppresses testosterone at higher doses, and sustained stress, which keeps the nervous system in a state that is physiologically incompatible with erection. What doesn't have meaningful evidence? Most of the supplement market. Testosterone boosters, libido formulas, herbal performance products. Most are not classified as medicines in the UK and aren't required to prove efficacy. Individual nutrients like zinc and magnesium have some supporting data as part of diet, not as isolated supplements. That's the honest read. The practical thing that makes the difference between trying all of this productively and trying it in the dark is knowing which of these applies to your specific situation. That's what assessment is for. If you'd like to understand what's actually driving your symptoms and what the most appropriate approach would be for you specifically, a free informal chat is the starting point. No commitment. The link is below.